Hello and welcome to Dental Ethics, Healing the Basics. I'm your instructor, Scott Irwin, for this module, and we will be walking through some of the basics of dental ethics. Now, based on feedback from most of you before this module began, I understood that everyone had covered dental ethics during dental school, which is pleasing to hear, and that your knowledge of it was at least functional. So I'm going to be making that assumption moving forward that we're working on a working knowledge of dental ethics to begin with. But to step back and put everything into perspective, why do we even look at dental ethics? Well, you all are in an accredited, CODA accredited program in dental study right now. And part of CODA accreditation requires that ethics and professionalism be covered during the program. And as you see in the graphic here, we cover four main areas: academic environment, research, patient care, and practice management. And more specifically, CODA wants to make sure that you know how to use professional codes, regulatory law, and ethical theories to guide your decision making. And that is why we will cover ethical principles, professional codes, and regulatory law, and ethical theories. So an overview of today's presentation, we're going to cover the basics of ethic principles, professional codes, regulatory law, and ethical theories. And as you look at all of these things coming together and where we're going to take them, you're essentially being asked to make an ethical judgment or take an ethical action. And how do you do that? I hear that from students all the time, that it seems a little vague, or you're lost in the woods, or you're just making it on a gut reaction or a gut instinct. And some of that is true. But I can tell you that because we have professional codes, some regulatory law, and we have ethical theories, that decision-making process becomes a little bit easier. Sometimes the answer to your ethical dilemma is actually found in those codes, regulatory laws, or even guided by the ethical theories. So view these things as your friends and not purely academic resources. Now, to give a basic review of the ethic principles, there are five main dental ethic principles at work. We'll start with patient autonomy. It's also just known as self-governance, and here we focus on the duty to respect the patient's rights to self-determination and confidentiality. We have non-maleficence, sometimes called non-malfeasance. This is known as do no harm. This is focusing on the duty to refrain from harming the patient and in fact protecting the patient from harm. Third, we have justice, otherwise known as fairness. This is simply the duty to treat people fairly across all categories that you could possibly think of, fairness across all humans. Veracity, also known as truthfulness, and this is the duty to communicate truthfully, regardless of the circumstance. And finally, beneficence. This is also simply known as do good, or otherwise the duty to act for the benefit of others. So now we get into the professional codes. And the professional codes come in a variety of formats. First is on a national basis. And if you're a member of the ADA, or if you're even familiar with the ADA, they have the Principles of Ethics and Code of Professional Conduct. This was published in 2018, and it is pretty much the primary guide recognized by organized dentistry for the five main principles. In fact, the ones that we just discussed can be found in their entirety in this document, with a lot of good examples and then commentary on expanding those examples. We also have state level professional codes. And here you'll just see a couple of examples that I put up. One is from the Texas Dental Association and one is from another state. These are primarily codes developed by state societies or dental associations that help guide how their organizations view an ethical approach to patient care and practice management. And finally, you also have discipline specific. I'm a dental public health dentist, so I placed up the dental public health ethical practices of public health. But each discipline usually has its own professional code of conduct, and you'll find those if you look in your specific discipline. All of these codes taken together can help inform ethical decisions. Next is regulatory law. Now, regulatory law can be all over the place, really. What I've put here are a few examples. It says includes but not limited to. You have state statutes, and these are often things that you'll find in jurisprudence material, practice acts, and so forth for the state. You'll also have guidelines from national organizations. Now, they may not be absolute law, but guidelines are often very influential in dictating how things play out. And so you see here the CDC provides guidelines, and they have legal health and safety issues. OSHA, AAMI, that's involved in patient care and infection control. You have the American Red Cross that affects things like BLS, and the Americans with Disability Act. And we see that more and more with access to care, comfort animals, and so forth. You also have things in the environmental realm, laws and guidelines. Think of things like the EPA. And then, of course, you have discipline-specific regulatory laws, similar to the professional codes. And then finally, we're in the military. So we often have military regulatory law and guidelines. Here I put a couple from the Air Force, such as AFMANS, AFIs, which are Air Force instructions, OIs, which are operating instructions, and now with DHA involved, we have DHAPIs, DHA procedural instructions. And on the right, I just took an excerpt from Massachusetts. This was part of getting licensed in Massachusetts. And if you scroll down, or if you just kind of peruse the items listed on that graphic, you'll see a variety of things ranging from things like amalgam, wastewater, the American Heart Association, sedating pediatric patients, and so forth. So you can see they expect you to be familiar with a variety of regulatory law to practice in their state. And now we have ethical theories. But before I get too far into this, you'll note that in the module, you had a link to be able to download an advanced organizer for the ethical theories. On that, you see a table or a graph that describes both of the ones that we'll talk about, as well as an exercise at the bottom where you can follow along and fill in the blank spaces. There are two primary ethical theories that we discuss in dental ethics. There are many more out there, but these are the two significant ones that most people will reference. The first is utilitarianism, also nicknamed consequentialism. In this theory, the end justifies the means. In other words, it's all about the result of an action or the series of actions, and more value is given to the outcome of the action than the action itself. Now, surprisingly, in healthcare, we follow this a little bit more despite our previous discussion we just had about regulatory law and professional codes. If you're familiar with any kind of a medical program show, you usually see the doctors rushing around or playing politics or having discussion with superiors and boards to try to get the best outcome for the patient. And sometimes they'll cut a corner, sometimes they'll go against a committee, maybe they'll break a rule in the hospital or whatever it is to get the best outcome for that patient. And then, of course, they have a heroic ending. In doing that, they're practicing consequentialism. In other words, the morality of the outcome is what dictates, is actually overrides the individual actions themselves. Now, some people may argue regulatory laws are, in fact, man-made, and they're based on a lot of precedents and a lot of discussion, a lot of situations. And perhaps a regulatory law or a professional code is difficult to adapt to every single situation. And in those cases, they may argue the regulatory law just doesn't have what it takes to provide the best outcome for the patient. And that's usually the argument made for maybe violating a regulatory law or something. But here the emphasis really is on getting the best outcome for the patient. Providers have to be careful in the fact that they're not violating too much along the way, essentially. In contrast to that is deontology. Now, deontology takes a little bit of the opposite type of view. Here you can kind of, in a tongue-in-cheek sort of way, say the means justify the end. Now here, deontology is less consequence-oriented. It stresses the ethical importance of both the action and the consequences. In other words, it's every action should be characterized by morality. It's the morality of the action that determines the morality of the outcome. In other words, if you follow each action and each action is moral or ethical, then whatever decision you come to on the end or whatever the outcome is on the end, by definition, should be moral and ethical. So it's a little bit more rules oriented. People will say it's a duty oriented or an obligation oriented ethical theory. And it primarily emphasizes rules following. And that is it for most of our content. Today we discussed ethical principles, brief review of them. We went into examples of professional codes, regulatory law, ethical theories, and we briefly discussed how all of these things can be your friend and can come together to help inform an ethical decision. Thank you.